Good afternoon, everybody. Welcome and thank you for being here. The focus of this talk today is to discuss the VQI quality improvement resources with a specific focus on charters. And by the end of this talk, you'll have a better idea about what QI resources are available now, future resources, and also the charter development. Together, we're going to review how to develop a charter using data reports to facilitate and drive quality improvement at your center. This is our agenda for today, which includes an overview of QI resources, where to find those resources, a breakdown of specific QI resources, charters, sustainability, and Q&A. Our QI resources include, but are not limited to, QI toolkits. I'm going to be focusing on developing a long-term follow-up toolkit in the fall. After that, there'll be a data manager toolkit that I'll be developing probably winter, like early spring. So that will be to follow the long-term follow-up. We also have a monthly newsletter, quarterly QI webinars, quarterly focus charter calls like the one today, quarterly regional lead data manager calls, and one-on-one meetings. A couple of additional resources include our annual QI abstract guide and annual QI supplemental guide. So now that I've kind of shared a few of our QI resources, I want to show you where these are located. So simply log into www.vqi.org and then make sure that you're signed into the members only section, which is located on the right-hand navigation. If you do not have a login, you can contact our marketing manager, Jen Correa, at jcorrea@svspso.org. And again, that's Jennifer Correa, jcorrea@svspso.org. And also, I just wanted to let everyone know at our next meeting in October, we're going to be doing a live presentation of our new and improved VQI website. So there are 8 navigation tabs currently across the top of our website, and we're going to talk about 3 of those tabs: the Quality Improvement tab, the Members Only tab, and the Resource tab. Now keep in mind, I'm only highlighting just a few of the quality resources because we won't be able to cover everything in one presentation. So again, we're going to talk about the 3 tabs across the top: Quality Improvement, Members Only, and the Resources. So the Quality Improvement tab offers a wealth of information. Using this tab, you can find past and future webinars, sample charters, focus charter call PowerPoints, recordings, and minutes, VQI VAM posters and presentations, regional information, networking emails, participation award information, and much more. Within the Members Only tab, you can find the annual QI abstract guide, the QI supplemental guide, and the QI rapid fire presentations. So we publish these every year around our VQI VAM timeframe, and the annual abstract guide are all of the posters that are presented. The supplemental guide is basically a quality guide, and then the rapid fire presentations are from the fellows and trainees and other physicians. Within the Resource tab, you're going to find Christy and Katie, who are our statisticians, the VQI reporting schedule, in which they did an amazing and extensive overview at VQI at VAM. So this reporting schedule, it provides the VQI regional quality reports and VQI best practices dashboard cut dates, anticipated delivery dates, and procedure timeframes. The report also provides quality initiative update and participation awards with their respective cut dates, anticipated delivery dates, and procedure timeframes. Also within the Resource tab, you will find VQI annual meeting quality abstracts, rapid fire abstracts, poster awards, and much more. So now that I've shared our QI resources and where to locate them, let's take a few minutes to focus on our charters. So SVS VQI centers work on quality improvement projects throughout the year. Last year, we had 74 charters, and I want to point out that 4 centers did 2 or more charters per year, even though you only get participation points for 1 charter per center or per year. I just wanted to toot their horn and just say, a great job for them. It was just a little over and above, and I just want to acknowledge that. So for a historical review of the charters from 2018 to 2021, you can see here on the charts, the topics were broken down into long-term follow-up, DC meds, documentation, and other. And other just represented a blend of the other 4 topics. It could have been long-term follow-up and documentation, DC meds and clinical. It was just a blend of the others. So charters can be individual or regional. They must be based on VQI data. And when developing a charter, I recommend using a blank charter as a guide. You will need to build a team, set an obtainable goal, set milestones, review your resources. You'll submit your charter to me for review. You will make a difference, and then share your story. So the first step to begin a charter is to review your data to obtain ideas. Other important things to consider would be to think about who you would like to be on your team, and think outside the box. Consider having a champion on your team. What is your goal? What is your objective? What do you want to answer, change, or improve upon? And how will you obtain stakeholder buy-in? So Christopher, our statistician, and Dr. Marie B shared with us at VQI at VAM. Despite being the most frequently produced report, there does seem to be a general lack of awareness with respect to the dashboards and the information contained therein. And while the regional reports remain an important emphasis for the VQI's quality mission, the dashboards also represent a wealth of information that can be used in tandem or entirely separate from the regional reports to aid in your center's quality improvement efforts. So the message here is use your dashboards and or regional reports for your charters. And as you can see here, this slide is from Christopher, the statistician. So your VQI regional quality report, it is the cornerstone, and there's 23 key targeted measures. But also look at your dashboard because it has over 200 measures, and there's a wealth of information there. So here's a snapshot of 3 dashboards provided by Christopher. And again, you can look at your dashboards. Where are your barriers, your outliers, your obstacles? Write down your thoughts, investigate, and review past reports and dashboards. Remember to look at the whole picture. And then once you have determined a focus, drill down even further using the dashboard. Again, do your homework. And here, reviewing the EVAR dashboard, you can look at length of stay, surgical site infections, MI, new dysrhythmias, CHF, any stroke, new dialysis, reintervention. These are just to name a few. And I wanted to point this out that one of our posters actually used the dashboard, and this was presented this year, VQI at VAM 2022, and it was the use of VQI modules to identify modifiable risk factors associated with post-op arrhythmias. And they used data from 6 VQI registries to identify variables associated with incident post-op arrhythmias. And here's just a picture, 2 pictures of them, and they were presenting their poster, and it was a great networking opportunity. So this is what we do. The posters are all displayed every year in a room, and we have a networking reception, and we have hors d'oeuvres and cocktails, and we just get to mingle and talk about all of our quality work and processes that we've been working on. It's just a great collaboration, and I just wanted to put this up there today just to share with everyone. So you need to build your team, find a champion, again, share your story, findings, thought, processes, and be prepared. These are simply examples of team members. So an executive sponsor could be a regional medical director. A sponsor could be a center quality director. Project leader is usually the data manager, but not always. Clinical sponsor could be the chief of vascular services. Process owners, data manager, Dr. Smith, and then your team members. Who are you using, within uh, your team to help this process? It could be IT, could be cardiovascular services, heart and vascular services, could be the scheduling team, so just, think about who all is going to help with your QI process. So make sure you set an obtainable goal. Your outcome metrics could be length of stay will decrease by a certain percentage in 12 months. Surgical site infections will decrease by a certain percentage in 6 months. And then your process metrics. 50% of EVAR patients will be discharged on post-op day 2, or 80% of our EVAR patients will not have a surgical site infection. For your milestones, make sure to fill out the months. Just don't leave like month 1 or month 2, and make sure you're realistic. Sometimes completing a QI project overview might take 6 months. It just depends on your project. So instead of saying month 2, say review of data, April through June. And that's fine. But, again, be realistic. And also, when you're setting a goal, make sure it's obtainable. Don't say we'll achieve 100%. That usually doesn't happen the first time. And you want to be successful, even if it's just by a couple of percentages. Set something obtainable for your first go around. I promise it'll make you be more positive. Answer the questions for your project overview. So we're going to do this together on the next few slides. So our problem statement, and again, this is just a sample. The VQI registry data shows that patients undergoing EVAR procedures had an increased length of stay from July 1st, 2018 to June 30th, 2019. Our center showed an additional 1 day to the median total and post-op length of stay for our center as compared to the regional and VQI overall. Careful review of the process indicated the delay was attributed to providing patient education in the pre and post-op phase. Our goal? Our aim is to decrease our length of stay for EVAR procedures by an average of 0.5 days by January 1st, 2023. And our scope? The patient population includes EVAR patients who meet the inclusion criteria for the VQI. So our deliverables. We will incorporate distribution of educational patient material in outpatient clinics to provide to patients and caregivers when scheduling their EVAR procedure, explaining in detail the procedure and recovery phase. By educating the patient and caregiver preoperatively, they will better understand their medical care and expectations, which will ensure a smoother recovery phase and earlier discharge. Our resources required: various clinicians, could be physicians, PAs, NPs, nurses, technicians, and they will be trained on distributing and explaining education material to patients and caregivers. Facility patient satisfaction surveys will be reviewed regarding education and preparedness for EVAR procedure before and after. Educational material is currently available, therefore no additional cost is required. Most importantly, review of registry data to determine success in decreasing length of stay will occur. So lastly, you really want to make sure that you have stakeholder buy-in. You're going to submit your charter to me, and I'll review it, and we'll discuss it via email or on the phone. And you are making a difference, just remember that. And make sure you celebrate your milestones and learn from your experiences. And then share your story by presenting at regional meetings and at the annual VQI at BAM meeting. And then how do you sustain and continue your QI project and charters? So I think this picture says it all. It takes a team to nurture and cultivate. Communicate with all stakeholders, provide updates, whether it be quarterly, annually, grow your team, and if someone leaves, replace them or add someone new with fresh ideas. Celebrate your small milestones, such as we've maintained long-term follow-up at 92% for 2 years. And don't put your project on a shelf to collect dust. Keep it fresh. Educate others. Mentor them on your center project. Are they a new stakeholder? New employee? What's next? What else can be done for this project? From this project or as a fresh project? And also, use new people that come in to use their new ideas. Now, next week, I have a QI webinar that's going to take a deeper dive into sustainability, looking at return on investment and external pressures. So we'll go much further into the sustainability of charters next week. So I hope you'll join me next Tuesday, July 26th, from 1 to 2. And the whole topic is going to be sustainability. And that's what this is about. So quality improvement, we're going to look at patient outcomes, gaps in care, return on investment, and external pressures. So again, it'll be an in-depth conversation next week on that. And that completes this focus charter call today. So we're going to open it up for questions. So we have first question, what type of sites complete QI projects? Are they mostly associated with university fellow programs that have resource people to do these? Or are they mostly community-based non-university hospitals? That's a great question. It is a mixed bag, honestly. You have little community hospitals that are doing quality projects, and then you have the bigger hospitals that are doing projects again. So it's honestly, it's kind of a mix, Barb. And sometimes you get those that are really looking to do a quality project on like a return on investment. Their stakeholders, they really want to see something on like length of stay, reducing readmissions, something like that. Whereas another facility, they want to see something on policies and procedures, more on the external pressures, something about accreditation, or something that's a requirement, like for TCAR procedures, right? So it depends on the site. It depends on the stakeholders. So I know that's kind of a long answer, but yeah, it truly depends on the center. And if you want to see different charters, please visit the website. I've started obtaining a few sample charters. I have to get approval from people to give us, allow us to put their charters online. And so we have just a few. I need to start getting some more approvals from those. So I'm making myself a note right now. But the charters that we do have up are great. But the other thing I would like to suggest is going through and looking at our abstracts, because you can also get ideas about that as well. Can you show again the table for submissions? I'm not sure which table that is. Let me go back.
Cut dates, Betsy.
The reporting dates?
Yeah.
Sorry if I'm making anybody dizzy. So that's found on your resource tab, and you just hit reporting, and then you scroll down. You can actually print this out. And it's a great resource. I think everybody asks Carolyn and I for this all the time. Where's that at? And they do keep it updated. So we have another question. How do we determine whether an outcome is significant and deserves attention? And honestly, that's up to you and your center. It may be meaningful for you to have like a 3% drop, where that may not be as meaningful to another center. Talk to your stakeholders and find out, what do you want to focus? That's the main thing. Is maybe you'll see like your carotid artery stents, your asymptomatic or symptomatic, one of those two you're having some difficulties with. Maybe you're in the lower percentage or the higher percentage, either or, depending. And you're like, hey, what's going on with that? So talk to your physicians and say, hey, do you think this is a problem, or do you think that was just a one off? Ask the stakeholders, do you find that this could be a challenge for us? And, poke around and look at the old data, look at the new data, and then you can go from there. Mm, yeah, your volumes are small. Yeah, that is smaller. But I mean, if you want to look at those, I mean, you can. That's not a problem. Maybe look at what you're doing, and that could be something also. The volume, you could, do a charter on volumes and being statistically significant. And somebody had also asked for Jen Korea's email one more time. So Jen Korea is our marketing manager, and whenever you go into the VQI website, um, I always suggest doing the members only. You have a little more access in there sometimes, and so it's JCORREA@svspso.org. So just in case. Have a quiet group today. Any other questions? Thank you, Barbara. She also reminded us that her email's on the site also, just in case. That's a good point. That is the nice thing. And also, if you forget your password or have password troubles, she's a guru with that too. So our website is going to, well, it's technically under. Will the 2022 VAM content be posted soon? I'm going to ask Jen if she would mind to maybe unmute and let us know when that'll be posted. I think it's coming up in a couple of weeks, but I just want to verify. And then this presentation will be posted as well on the website, so look for that.
Betsy, it's Jen. I'm happy to speak to the presentation. So for everyone who registered for VQI at VAM, either remotely or in person, those presentations are live now. We're asking that everyone go to vascular.org. That's the SVS site. And when you go to that site, you'll see a spot about midway down the homepage that says 2022 VAM, and click on that, and it's going to take you to the online planner, and you'll see VQI is right on there. You'll be able to spot it right away. I do want to just remind folks that you may, depending on how it clicks in on your computer, it may show you only Tuesday, but if you go just a little bit above at the top, you'll see tabs that say both days, Tuesday or Wednesday. And again, all those recordings are available, and I would be happy to share the link with the attendees here that are on the call, just so it'll send you directly there. So I'll send that following the call. And then in about 6 months, those presentations will all be available in the members only area.
Oh, awesome, Jen. Thank you so much.
Sure.
All right, so in October, we'll do a live presentation. Jen is actually going to help me with that. We'll do a live presentation to get you acclimated to the new website for the different quality areas. We'll do like a little PowerPoint with some screenshots, and then we'll take you over and kind of walk you through live. And then there's going to be a couple of I know, presentations for the website because we want to make sure that, we do everything to educate you on that. But I thought that would be something nice for everyone to have. So Jen and I will be doing that in October. If there's any topic that you're interested in, you can email me, B. Weimer, B as in Betsy, and then WY, M as in Mary, ER at svspso.org. Feel free to email me with any topics that you're interested in. I just thought the website would be a good topic because it's hard to maneuver sometimes, and especially when we change things on you, I want to make sure that we show you where everything is. Um, and then I think that's it. So again, the next webinar is October 11th for Focus Charter calls. And again, it'll be for the website specifically. But next week is the quality webinar. And again, it's just taking this to the next level. It's all focused on charter sustainability, mostly toward ROIs and external pressures. And also, I'm going to be sharing 4 more of our quality improvement abstracts that were VQI at BAM this year. Again, want to share, our center quality projects and show what you can do and how you can do it. And I have an ROI calculation sheet to share with you on that. And again, if you have any ideas or thoughts on something that you would like for me to speak on or a topic or anything, please feel free to reach out. And then Jen will share the vascular website link also after this. So we'll make sure that we have that out to you. So anyway, well, thank you all for joining us. I'm going to give you back, looks like 31 minutes. And so great questions. So thank you all. And I hope you have a great rest of your afternoon this lovely Tuesday. So take care, everybody. It was great to have everyone today.